tell us what you're happy about.
I feel like I found myself again.
And what did you start with?
I started with a sense that I really was aging and that there were creases, and when I was driving and bored in traffic, I would flip down the rearview mirror and I would look and I would think, ooh, I don't like this.
What did you see that you didn't like?
I felt like I had bags under my eyes and my neck. I would sit in traffic pulling my neck like this. And one day I had lunch with a girlfriend and she said, you know, Dr. Brunner could really help you with those things. I know you've been seeing someone, but I don't think you've gotten the results that you could get.
So about 2 months ago, we did a procedure called Face-Tite to tighten the neck. So she had skin that hung down, and now it's smoother. She still has a little bit of platysma bands there, but this is a non-surgical procedure done here in the office. Requires just 2 little stitches here and behind each earlobe, and an hour procedure in the office. A minimal recovery with just 4 days wearing a support, and your neck skin is tighter and you've got your jawline back.
Wow, so how are you happy with your neck now?
I have a smooth line from here to here as opposed to having a stop and drop right there.
That's the best. And then a month ago, we did a little filler in the cheeks and folds and lip lines. And how do you feel about that?
Well, I'm able to wear lipstick differently than I ever have before. And I feel like I have my younger self back. I have a picture on my vanity of my husband and I when we were married 40 years ago. I recognize myself in that picture now.
Aww.
That's the best too.
So you couldn't wear lipstick before?
My upper lip was so minute in comparison to my lower lip. You know, I had Semitic lips. And there wasn't anything to put it on. And if I ever moved my mouth a little bit, I would have lipstick all around in a big, messy.
Wow, because no one would ever think that you've had fillers.
Anything
it looks
at
so
all.
natural.
And many people think that to do the lips, you have to have these big, overblown lips. But lips really just need to be proportional to the rest of the face. And people want to look smoother and have a place to put their lipstick. So when it's proportional, you should not notice that the lips have been injected.
Beautiful.
And then 2 weeks ago, we did an upper and lower eyelid lift to remove excess skin hanging over and puffiness on the lower lid. And there's still a little swelling there, but
2 weeks ago. Wow.
Probably not even.
right.
So what was the recovery like? Truthfully.
It was, first of all, I had wanted to stay home from work for a long time. So it was very relaxing. I kind of liked it. I lounged around.
Was it painful?
No, I had no pain. I had a little discomfort. My eye and the ball and the lid, were not quite as in the same contact that I was used to. And then it was fine.
And for 2 weeks, it doesn't look like you've had anything
2 weeks,
done.
it was nothing. I did have one meal where I didn't want to open up my eyes, so I ate with my fingers, kind of guessing what it was. That was kind of fun. It was fun. I had watermelon and feta, and I was like, okay, which one is that? It was really kind of nice.
Yeah, we compared notes on that salad.
We laughed about
Yes,
the
we did.
foods. It was hot summer day, but
Wow.
it was not uncomfortable. I really was not uncomfortable, and it was really 2 weeks ago. And when I came in 3 months ago, I had had fillers from another physician underneath my eye that were sort of bluish, and it always gave me like a dark look underneath. And the first thing that Dr. Brunner recommended was removing those.
She got a little Tyndall effect.
What's the Tyndall effect?
Tyndall effect is when the filler, which is usually a hyaluronic acid filler, you can kind of see through the skin to the filler and it shines blue. And what it is refraction of the light getting into the filler, bouncing around in the filler and showing blue. And so it's not a good look. So some people can't have filler under their eyes. It gets swollen and blue, and you have to remove it with a hyaluronidase. So people will have these blue bags under their eyes that can last years, and it just takes minutes to take it away.
Wow. So overall, what would you say to someone thinking about getting a little touch-up work done?
When I would say do it sooner rather than later, because it's going to be here for a long time and you might as well enjoy it. And there is, you feel anxious. You feel like it's going to be like a 1960 black and white movie where you're going to wake up and you're not going to be yourself, you know? That's how plastic surgery was communicated so long ago. It's so different. And I look exactly like I did, just a little better.
Wow, and so when your friends see you now,
They don't really, they just, so the people that I've seen say, did you really do anything? Like they're not, oh, you look the same, kind of. Like they're not sure.
just better.
They're unclear. They're just unclear what's going on. But then I say, well, you know, do you remember? You know, do you remember this? Do you remember this? I'm like, oh yeah. So, it, you know, it's subtle. And I think that's what's good about it.
You just look smoother.
Smoother.
Thank you.
Thank you very much.
Any final words?
Do it.
And enjoy.
Yeah. Thank you.
Thank you so much.
You're welcome.